The aged care industry is relying on a funding boost from the federal government in the upcoming budget. A 15-point plan handed down after the Royal Commission identifies key priority areas to ensure that Australians get most benefit in the quickest time. Joining me now live is Patricia Sparrow. She's the CEO of Aged and Community Services Australia. Thanks so much for your time, Patricia. I mean, we're hearing a lot around what might happen in the federal budget when it comes to aged care. Have you given any indication of what is coming?
So I think we know that there is going to be something in the budget for aged care, and there has to be off the back of the Royal Commission. My colleagues and I in the Australian Aged Care Collaboration, which is all of the provider groups who've come together, have, as you said, put forward that 15-point plan about the things that we are expecting to see. And we're expecting to see those because our prime concern is making sure that our services can support older people in the way that we want to, in the way that the community actually expects. So those are the things we've put forward in the plan.
Yes, and we hear about staffing ratios. Of course, money doesn't solve everything, but it certainly does help. What do we need to see in terms of long-term certainty?
So I think what we need to see, and one of the things is we want to see a fundamental overhaul of the system. And so one of the things we'll be looking for on budget night is to see that there is going to be fundamental reform and that there is a plan that outlines what the reform's going to look like, what the timeframes are and when that's going to happen so that providers can plan with certainty. We want to see a fundamental underpinning of that by the development of a new act that's based on human rights. We think that's really important and will set the whole system the right way forward. The current Act focuses on the relationship between government and providers. What the new Act needs to focus on is how we support older Australians in the way that enables them to live a good life. You've touched on staffing. We as providers, we want to be able to employ more staff, and we saw time and time again in the Royal Commission families talk about and providers talk about the fact that they would like to employ more staff. We want to be able to pay them better, and we want to see them being able to be trained really well, and we need to see that happen in the budget, that's where a lot of the funding uplift, because while the Act is also a fundamental underpinning, none of what we do can we do without a skilled and committed workforce, and so the workforce is the other part that's absolutely critical.
The NDIS obviously has a levy to pay for it. Hypothecated spending does give certainty into the future. What is your view on some kind of levy or hypothecated spending? Is that what you'd like to see, or do you think the government can do without it?
Well, certainly a levy was a recommendation of the Royal Commission, although the two commissioners didn't have a set view on that. I think the primary focus for us is that there needs to be enough investment. And we've had 20 years of 20 reports all showing that there hasn't been enough investment, and the Royal Commission has underlined it in big bold capitals. There is not enough investment in older Australians in this country. Now, whether it's a levy or whether we actually see an increase in general revenue with those who've got capacity to pay being asked to pay more, and making sure that those people who can't are protected and still get the same level of service that they need. These are the things that we want to see. And in some ways we're agnostic about that. There just needs to be enough money in the system to make sure that those older Australians that we're supporting are getting the level of care that they need. And I should say, Laura, a big part of that is people who are living at home, which is where most older Australians want to live. We have nearly 100,000 people on a wait list. Some of them will wait for more than a year to get a home care package. That's support that they need right now. And one of the key things we'll be looking for on budget night is making sure that there is a commitment to making sure that people that are on the waiting list actually get a service as quickly as possible. There are workforce challenges in that, so that's going to have to happen over a period of time, but also that people who then come on to the wait list don't wait for years. So, there's significant reform that needs to happen. We're going to be looking across how we support people at home, what government's going to do in residential care, so that people are supported well in residential care with staffing. And we know as providers that we also need to make sure that we are much more transparent. We know the community wants to know more about where the funding's going and how people are supported, and we're committed to that. And we'll be looking for those things on budget night.